As Indiana reopens for business, we're taking your questions to local officials and industry experts. How will the virus continue to impact our state's economy? And what's being done to help you and your family or your business bounce back? We'll ask Congressman Andre Carson, Congresswoman Susan Brooks, Department of Workforce Development Commissioner Fred Payne, and mayors from Indianapolis, Fishers, Evansville, South Bend, Fort Wayne, and Terre Haute. Our In Focus Coronavirus Town Hall starts right now.
And thanks so much for joining us tonight for our In Focus Coronavirus Town Hall. I'm Dan Spieler, joined tonight by my colleagues Fanchon Stinger and Bob Donaldson.
Good evening. Tonight we are bringing together state leaders, lawmakers, and industry experts to answer your questions.
We'll take a look at the path to economic recovery for both workers and businesses. But first, let's take a look at today's coronavirus headlines. Starting Friday, most of Indiana will move to stage 3 of Governor Eric Holcomb's Back on Track plan. The governor will sign an order to make it official tomorrow. He says all but 3 of Indiana's counties, Marion, Cass, and Lake counties, have, quote, earned the ability to move forward by following social distancing guidelines.
And starting Friday, gyms can reopen and recreational sports practices can once again start. Community pools and campgrounds can also reopen, and gatherings of up to 100 people will be allowed. Again, this is everywhere in the state of Indiana except Marion, Cass, Monroe, and Lake counties. Dan?
Well, we're also talking about the latest news from Capitol Hill with the House passing what's known as the HEROES Act on Friday. And we'll bring in Congressman Carson and Congresswoman Brooks to talk about this first. You both voted different ways on this bill. Congressman Carson, you voted for it. Congresswoman Brooks, you voted against the bill. So I want to hear some of the top reasons you voted the way you did. And Congressman Carson, I'll start with you.
Well, for me, the HEROES Act honors our heroes. It provides nearly $1 trillion to local, state, and territorial and tribal governments who desperately need those funds to help vital workers like first responders, healthcare workers, teachers, and those who are on the front lines keeping us safe. It establishes a HEROES Fund for essential workers. We're talking over $200 billion. It supports testing, tracing, and treatment. It also provides additional direct payments, cushioning the economic blow that the coronavirus has put on so many Americans, especially Hoopers.
Congresswoman Brooks, why did you vote against it, and might you support Senator Young's Restart Act instead?
Well, thank you for the question, Dan. I think that we knew that this was truly a messaging bill, a starting place for the House Democrats and for Speaker Pelosi. It was crafted not in a bipartisan way at all. There were no committee hearings. There were really no discussions. The bill was an 1,800-page bill that was put before us in just a couple of days. The summary was 90 pages in and of itself. And so while there are some things certainly that are in the bill that I would agree with, and I believe that we will find bipartisan agreement on, it truly was a huge wish list from the other side. And there was no debate and really no discussion about it. And that's why it went down almost exclusively on party lines. But I do think we will, and both sides of the aisle are definitely negotiating and debating and discussing now in various meetings and various hearings that we're beginning to have. And we're certainly having a lot of communications with our colleagues over in the Senate. And so now I think the Senate will actually craft a package, probably taking some of what was in that bill, certainly. And we do need to honor our heroes. And I agree with my friend, Congressman Carson. We absolutely need to honor our heroes on the front lines. We need to make sure that they are getting supported, but we need to make sure it doesn't go far beyond COVID. And that's what this bill did. It went far beyond the impacts of the COVID pandemic.
All right, we'll certainly see what happens next on that. Fanchon?
Well, next we do want to get to a question from one of our viewers. Congressman Brooks, as Indiana and states around the country begin to now reopen, Judy from Carmel wants to know, how do you balance the cost of human lives with legitimate concerns about helping our economy? Once again, Congresswoman Brooks.
Well, I think there is not a public official at any level of government who is not incredibly concerned about human lives and about the safety of those lives. And that's why it's very important that we do what we can to boost the PPE materials that are available, that we do what we can to educate how to make our workplaces as safe as they possibly can be, how we continue to push out messages about just how we keep ourselves safe. I think whether it is wearing of masks in public places, which I am in agreement, we probably need to do. Some people may need to wear gloves. We need to be doing those kinds of things. Right. But we have to get our economy going again, because too many people, whether it's losing their health insurance, whether it is losing their jobs and how to provide for themselves and their families, we've got to find a way to safely get people back to work.
Definitely a delicate balance. Congressman Carson, I want to put the same question to you. How do we balance health and human lives, keeping the economy strong?
It is certainly a balancing act. We want to see our Hoosier businesses strengthened. I agree with my colleague Susan's point. But I'm very alarmed by the statements that argue that we need to put our vulnerable populations at risk in order to save the economy. I strongly reject these statements as callous and un-American. If we follow the scientific advice from public health professionals, I think we can continue to support our small businesses, but we'll also be able to protect public health and support our economy at the same time.
All right, the debate on how to exactly do that will definitely continue. Bob.
We want to bring in Workforce Development Commissioner Fred Payne into our conversation now. Mr. Payne, your agency handled more than 900,000 claims in the first 2 weeks of May, but we keep hearing from viewers frustrated with your agency's backlog. Some tell us they first applied for unemployment back in March and they have yet to see a penny. What problems still need to be addressed even today to issue those payments?
Well, Dan, that's a very good question. First off, thank you for having us so that we can share our information about our workforce development system and our unemployment insurance system. A vast majority of the claims, about a little bit over 80% of them, get resolved within 21 days. Those claims that go beyond 21 days require what we call intensive investigation. That means that an individual person must investigate the issues. Those claims cannot be automated. And the majority of those issues center around about three things: deductible income issues, workplace issues such as voluntary quits, and employment status. Those are things that take a large interplay between employee and employer. Sometimes we have to make different phone calls and we have to get information from an employer. Then we have to turn around and get information from the employee. So generally speaking, again, those claims by and large get resolved within 21 days. Those that don't require extensive investigation by what we call our adjudicators.
So given all that, given what you just told us, what is a realistic timeline for when the department will actually get caught up on all of these payments?
Well, that question is a good one, because each claim has to stand on its own merit. And so what we're doing right now is we're making sure that we're working from those claims that were filed the earliest. We're working our way backwards. So it just depends on the claim that is presented before us and the type of issue. That's what makes this a little bit complicated, because it all depends on the issue that's involved that the investigator is looking at. So I can't give you an answer on a specific claim because they are so fact intensive.
We have a question here from viewer Shelley Kataw. She and many other people have described waiting hours on hold for the state's unemployment call center. And she says when they do get through, they're told the employee can't look up their claim. Here's what she told us.
I still have yet to hear back from a claims investigator. It's been 5 weeks. We're just told the same thing. They can't pull up our specific claim. And I guess one of my main questions for DWD is, why can't they track an individual's claim and find out where it is in the system? Has it been to an account?
So, Commissioner Payne, how do you respond to her specific concerns here on the call centers?
Yeah, so what we did when we first started, we had a plan of hiring additional people to man our call center and to also help adjudicate claims. What we're seeing is that when callers call in, they need a deeper level of understanding of the issue that's involved. So by and large, they may end up getting an individual who may very well be able to help them with some routine matters, but then that particular caller may have an issue that requires a little bit more expertise to get into the issue. So that generally is the issue that's caused when a person calls in and they don't necessarily get the answer that they want or that they need to help move their claim forward. But also, I want to say that what we've done over the past few weeks is we have reduced our call wait time by a little more than 60% between the last week in April and today. So we recognize that even though we're making improvements to our system, that not every claimant who makes a call is feeling them, but we're trying to make sure that they do feel it. And one way that we're seeing that our metrics are improving is with that call wait time.
Okay. All right, Commissioner Payne, here's another question about unemployment benefits. This is from Mary McCloskey. Now, Mary is an interesting case. She runs a Facebook page where more than 4,000 Hoosiers try to help each other with unemployment issues. Some of them are worried about what will happen when they're called back to work but don't have child care. Listen to her question.
If that person that doesn't have child care doesn't go back to work, then they're going to tell them they have to resign. So my question is, if they resign, do they still qualify for the unemployment because they have to take care of kids?
Commissioner Payne, what is the state's policy?
Well, that's a good question. Generally, before we went into this, and the governor had relaxed some of the rules to ensure that many Hoosiers can get covered by our unemployment insurance system, child care was one of those issues that would render a person ineligible for unemployment. Then, as a relaxation of the policies to ensure that we covered as many Hoosiers as we can, we did start covering that. But as individuals start going back to work, we are trying to encourage them to have a dialogue with their employers to try to talk about telework and a variety of other things. Because eventually, what they'll do is they'll tell us or they'll talk to us, and then they'll let us know that it was because they did not have child care. And under the state policy, by and large, they will not be covered. However, there are provisions under the federal guidelines under pandemic unemployment insurance that they may be covered under.
Let's transition now to questions about the economy as a whole. And for that, we're joined now by Matt Will, Associate Professor of Finance at the University of Indianapolis. When it comes to recovery, Matt, are there sections of the economy you think will recover faster than others, and what areas might see a slower recovery?
Well, I think the ones that are recover faster, obviously pharmaceuticals for the reasons everyone could imagine, medical, because there have been a lot of deferred healthcare procedures that people haven't been doing, so that should come back quickly. Manufacturing, just because there's such a pent-up demand in the economy right now. And then all those things that were made overseas, PPE, textiles, advanced manufacturing, should grow well. And Indiana is really in the sweet spot for that. For the slow side of the recovery, I'm really concerned about the entertainment industry because we are an entertainment-based economy. We have tourism, travel, movies, concerts. You know, tourism alone accounts for about 2.5% of Indiana's economy. That generates about $1.2 billion a year in tax revenue out of a $17 billion budget. And I've kind of done some estimates, and I think we're probably going to reduce after the recovery about $590 million a year in tax revenues. And when those people who have lost their jobs, about 38,000, can't get jobs again, the wages, that's going to put a tremendous stress on the economy and on state government's ability to fund, which we just talked about, unemployment benefits.
Well, let's talk about that long-range effect a little bit more, Matt. As people return to work, what could be some of those long-range economic effects of the pandemic? Could we see more layoffs, higher taxes in the future, or is it just too soon to tell at this point?
You know, we're definitely going to see more layoffs because the way the CARES Act is designed, once those benefits expire, a lot of the employers will lay folks off because some of them are just keeping them on because they're getting that benefit from the government and they hope to get that loan, you know, forgiven. It really boils down to the vaccine and treatments. Because, you know, the economy really has to get back in motion and the government is in charge of that. Will they relax situations? Will they allow people to get back to work? Can we manage doing both at the same time? Let those people who can work go back to work, protect the people who are the most vulnerable. You know, I think we're smart enough to be able to balance the two and do it properly. Make sure nobody gets injured, but also make sure people get back to work. It really depends on the vaccine. I am nervous about a tax increase. That's probably one of the worst things you could do. Illinois, California, they did that during the Great Recession just a few years ago. It was disastrous. Indiana cut taxes at that time. It boosted our economy. We weathered that recession very well. So I hope that the members of Congress here look at the economic impact of their fiscal decisions here in the future.
Let's go ahead and bring Congressman Carson into our discussion. Taking that into account, how is the federal government preparing for the long-term economic effects?
Well, there have been numerous discussions. I think the economist, very brilliant, obviously, he outlined it well. You know, there's one school of thought that suggests since gas prices are so low, now is the time to raise the gas tax. Others are saying that's unacceptable. Perhaps we should look at a European-style value-added tax. But I think I agree. During a recession, politically, it's unwise, but realistically, it's unwise to cause an additional burden on folks who are already suffering. We've already had 30 million plus apply for unemployment, and we're at over 14% in terms of our unemployment, the largest since the Great Depression. I don't think timely, it's untimely, but I also think that we need to look forward at making sure that the HEROES Act and other measures are passed by the Senate. So we have to press Mitch McConnell to do the right thing. Now is not the time for political posturing or being afraid of the Trump administration. Now is the time to make sure that we do what's right on behalf of the American people.
We're going to be talking about those issues to come as well. We want to thank Professor Will, Commissioner Fred Payne for joining us, Congressman Susan Brooks, Congressman Andre Carson. We'll stick around for our next segment. Dan?
Yeah, up next, Bob, our conversation continues with a pretty hotly debated topic in the news.
Yeah, we're going to turn up the heat a little bit. Should you be required to wear a mask inside a business? We're going to hear from our panel on that topic of discussion. Plus, big heads up, PPP do's and don'ts. We have what you need to know about coronavirus relief loans. Don't go away.